Hello, I'm Britton Clennett and welcome to China Insight, where we discuss the latest issues affecting this rapidly changing country. Well, the International Congress of the Transplantation Society came to a close earlier this week. The sit in Hong Kong saw some of the world's top researchers and medical experts gather to discuss organ transplantation practices. A new system for organ transplants in China took centre stage, and to help explain the reforms, I'm joined by Dr. Huang Jiehu, Director of the National Organ Donation and Transplantation Committee. Welcome to the programme.
Thank you, Britt. Yeah.
Now, what was your role at that Congress? I understand you were China's first keynote speaker at the event. That must have been quite an incredible moment.
Yes, I'm very happy to tell you this was a very important event for the global organ transplantation communities. And the Hong Kong event actually is the 50 years anniversary for the global and the transplant families. I was invited as a key, and this Guangzhou Declaration actually is whole the society, Chinese transplant societies have a summit meeting in Guangzhou. Actually, this meeting is a cohesion of reform consent. And after that, this years of 2007, that is the organ transplantation regulation was elected and issued by the state councils. That's paved the way, a legal framework for the organ transplantation to guide organ transplant practice in China. And then the years of 2008, also. And after that, the many things happened. So the years of 2014, on behalf of the Chinese government, I declare and stopping using the organ from the executed prisoners and beginning from the January 1st, 2015.
Okay, well, I think that introduces us into the following report nicely. We look into the country's reform on regulations, systems and standards on organ transplantation. Let's take a look. This is the 26th International Congress of the Transplantation Society, an annual global event. This year it's being held in Hong Kong, where more than 1,000 experts from around the world have gathered to get to the heart of the big issues facing organ and tissue transplantation. The largest and most authoritative global academic conference of its kind, this is the first time it's being held in China. On August 22nd, Huang Jiehu, Director of the National Organ Donation and Transplantation Committee in China, made a speech on the latest development of the reforms of organ transplantation in the country.
Starting from January 1st, 2015, the death penalty prisoners' organ will not be allowed to be used at any circumstances. The community-based Chinese citizen organ donation has become the only legitimate source of transplantable organ in China since then, which must not include a single death penalty prisoners in legitimate system quotas. The achievement of transplant reform in China is only preliminary, and is only the first step of a long journey.
Since 2010, China has been modernizing its organ donation system. And in 2015, it banned the harvesting of the organs of executed prisoners. The nation now relies on voluntary donations from the general public, a move that's in line with the standards of the World Health Organization, and one which has garnered praise at home and abroad. Much like the race to get organs from donors to recipients, China's transplant system is rapidly changing.
I see China evolving, emerging as an international leader. China has changed greatly in its practice. I've traveled throughout China. I've visited with the donation and transplant professionals. I've worked diligently for the last decade with the leadership of China that seeks to change it to practices that are compliant with the World Health Organization and the Declaration of Istanbul. And in my experience, China is changing, that the use of organs from the executed prisoner is no longer permissible within China.
The difference is that now people in China trust in the system and they feel that they could be transplanted if needed and they could donate if needed. So my impression is that now, from now to the future, China is moving so quick and doing things in the proper way, according to WHO guiding principles and some other ethical practice, that in a very short time, I say 2, 3, no more than that years, China will be leading the transplantation worldwide.
And so I have seen the rise of transplantation in China, and now I would say the new beginning. I knew that the reforms, number one, were worth it, and number two, were going to be successful, and China was going to lead the world. China has the ability, as Jose said, to lead the world because it's learned from all of our mistakes all around the world, number one, and it has the population and the need to make strides that we have been unable to do in the rest of the world.
The most recent statistics reveal that about 120,000 organ transplantations take place worldwide annually. In 2015, about 8.5% of these, roughly 10,000 transplants, took place in China. Since the nation's first successful organ transplantation in the 1960s, the annual average number of transplants in China has risen to be the highest in Asia and third highest in the world, behind the US and Brazil. About 1/3 of the organs come from living donors, usually one family member for another. Prior to 2009, nearly half were from executed prisoners before this system was phased out.
Harvesting organ from the executed prisoners is a request from the medical and the sectors. It's not a national policy because the doctor want to save the life of some patients and request to some local call and get the organs. It's not a national policy. We have never got a legislation to permit to use the organ from the executed prisoners in China.
In 2007, the Chinese government created a new regulatory framework for donations which stipulates that human organ transplants should be voluntary and free. 3 years ago, it established what it calls the Organ Transplant Response System, designed to encourage organ donations and ensure people in need have an equal right to a potential transplant. The system automatically allocates newly donated organs to suitable recipients on the waiting list. In early 2015, the National Health and Family Planning Commission of China announced the establishment of what is called a green light transport network for the rapid transfer of donated organs. It wasn't long before the first long-distance lung transfer occurred. The organ was conveyed between Chengdu in China's southwest and Wuxi in the east. A 2,000-kilometre journey by road, air and rail done in a few hours.
Timing is the most important thing for us.
With the clock ticking, the lungs are removed, packaged and then rushed by ambulance down cleared roads to Chengdu Shuangliu International Airport. It's raced through the terminal in 10 minutes and it's on its way.
Lungs have to be transplanted within 6 to 12 hours after removing them from a donor.
3 hours later, it arrives at Shanghai Hongqiao International Airport. After a 20-minute trip to the nearest bullet train station and a high-speed ride, the organ is again loaded onto an ambulance.
That's a challenge for us, as well as for the transportation departments.
It arrives in the operating room 15 minutes later. The whole journey takes 5.5 hours. Just 30 minutes more and the transplant window would have shut.
So this is a new regulation, will help for a lot of people. So we just want to make this a good example for many people, many hospitals to follow.
The organ for transplantation now become the VVIP of any transplantation. So that is the very concerted effort from government side to promote the efficiency of the organ transplantation. And that has very important meaning for us. That means the government now has determination to put the individual patient's life on a high priority.
This is Jiangmen City in Guangdong Province. Surgeon Li Peng is on his way to the intensive care unit in a local hospital. He's able to tell if a patient is suitable for an organ donation.
With brain failure. Results from ultrasound scan, EEG and EMG show a total loss of brain function.
As an organ donation coordinator, the responsibility of asking the patient's relatives if they will authorize a donation falls to Li Peng.
It's hard to tell if it is suitable for organ transplantation.
Li Peng explains to the patients or their families about the organs which can be used for transplantation. Where each one goes, they can save. In the past, volunteers were slow to donate organs because they felt it went against traditional cultural practices of keeping the body intact after death. But lately, as more people understand the life-saving nature of organ donations, attitudes are changing. Anhui Province provides the perfect example. In 2011, only 41 people decided to donate their organs after death. That number increased to 70 a year later. Now, even the elderly are volunteering.
为什么就是捐献仪器教育医学教育它没有仪器它是没办法它学会的。这个目的就这个。
希望我们不可怕，我写的当个英雄好汉，人家不干，我心要做些仪器。
Globally, the demand for organs far exceeds supply, and China is no different. 9-year-old Yang Shiyi has suffered from kidney disease for most of her life. Her survival had depended on getting dialysis every 3 hours for the past 6 years. She's been on the transplant waiting list for more than 4 years. But there are 25,000 others on that list. The question of who gets priority has for long been a difficult and emotive one. But now, thanks to the transplant response system, there seems to be a way forward.
The organ allocation we developed based on the requirement from regulation on human organ transplantation announced by the State Council in 2007, which said the ranking of the patient, the allocation of the organ, only based on the medical needs of the patient. That's the only sentence in the regulation related to organ allocation. But how could you define the medical needs? There are very well matured standards in the international society.
Under the system, the allocation of organs is determined by computer and is based solely on the medical requirements of the patients. The automated process is designed to minimize the possibility of human intervention, and it is monitored by a 40-person oversight committee. The transplant response system promotes transparency and fairness. The Green Light Transport Network is helping to get these organs to those who need them on time. And for those in need of new organs in China, hope is rising because of the big hearts of those who are increasingly choosing to donate. How in demand are organs in China? What are we talking about in terms of waiting time?
You're right, and theoretically, there are 300,000 patients dying of the organ failure every year who could be saved by organ transplant. However, there's several restricting factors affect the number of organ transplant. Firstly, probably is the economic reasons, because organ transplant is very expensive, Medicare and so majority of people in the medical insurance in China still is not cover expenses for the organ transplant. The second and limiting factor is the capacity. You need some competent doctors, surgeons, and well-equipped hospitals. So far in China, just 169 transplant hospitals. So then we just can provide around 10,000 organ transplant a year. The third factors is shortage. Like every country in the world, the shortage of organ is problems. So, for instance, last year, in our quotas, actually it's a computerized waiting list. It's 28,000 patients waiting for organ transplant. So last year we just have the 10,000 patients were saved by organ transplant.
Okay.
That's the numbers.
Could you talk us through the biggest changes that have occurred in China in this area since 2015?
Organ transplantation used to be relying on the prisoners for many, many years. Organ transplant used to be a very high sensitive topic. Nobody talk about, but everybody know what's happening behind. So there is not the services accessible to ordinary people. Since the 2015, the organ transplantations is carried out under sunshine, transparent, just, fair. So then become a medical practice and rely on the social interdependence. So the people can donate. Also, people are entitled to receive. So as a recipient.
The first half of 2016 saw a jump in donations in China by some 45% compared to last year. What's your take on this? How do you interpret this?
As long as the people are aware of the significance and the meanings, and more people are willing to join this secret and cause. So in this year, compared with the same period of last year, is a 45% increase. That means in this year, we are expecting 4,000 cases for disease, civilian, voluntary organ donations. And then we can fulfill around 15,000 organ transplants this year.
That's quite a difference, isn't it?
Yeah, it
How
is.
has the World Health Organization received this new system in China?
WHO and as well as the international societies, including TTS, always stand and with us, help us, support us on the China organ transplantation reform. So without their help, it would be no organ transplantation reform in China. So our system and has been established and following and the WHO guiding principle, also root and based on the rooted Chinese culture.
And on that, I just want to ask you, what effect do you expect this to have on China's international reputation?
I read the articles, actually, as some not remarks from our President Xi Jinping, and they stay true to the mission. And so for the mission for a surgeon is to establish ethical and national organ transplantation systems. Is the mission, is the core of the times. So the message for the world is everybody, every sectors, we must make China voice, get the voice in China to be heard in the world in terms of organ donations.
So you decided to get involved in this process, in this cause. Can you talk about your role in it?
Yeah, my role, everybody call me the orchestrators for the reform. I think that, as you know, I'm a surgeon. I still keep my practice and as a surgeon in the PUMC hospitals. And I think that now I feel this is my mission, it's my duty.
There's been discussion that traditional culture in China dictates that when a person dies, their body should remain intact, and that this has perhaps been a discouraging factor for people donating their organs. What's your take on this?
China, like any country in the world, the culture always just like two sides, both sides as a coin. You have a positive, have a negative. So we, as a doctor, as a surgeons, and in terms of organ transplant, organ donation, we cannot emphasize the negative side behind time, because Confucius and have many sayings encourage organ donation. For instance, he said, saving a person's life is much better than building 7-story pagoda. He also advocated mutual and respect, love, mercy, and benevolence. Many and core values are Confucianism. So he mentioned keep the body intact, called filial piety. That means not throw away, not cast away your organs. If you live in the present time, I think that he would be the first person to sign for organ donations.
In your view, if it's not tradition, what is it then? Why weren't people donating their organs?
The backward reason for our organ donation and the situation, and we should blame the administrative system other than the culture. Because for many years, we have not established an organ donation system for the public. So, as a matter of fact, we conducted a survey in the 4 universities. 70% and the students are willing to donate, as long as the system is open, transparent, and just, fair, and 70% of the students are willing to donate organ after their death. Actually, this is not the culture, it's not the tradition, therefore.
Why would you feel comfortable giving your organs?
I think it's okay. If I die, I can use my body to help others.
人已经不在了，你留了器官有什么用啊？也没用了，也就 能造福下一代就造福下一代了，能造福人类造福人类。
因为这是我身体的一部分，这也是以我的一个形式遗留在这个世界上的一种方式。
比如说接眼睛啊，还有还有一些什么肝脏呀，还有肾脏呀，但是就现在一般普及的不够，也不知道在哪儿捐赠，是吧？你这要有一个机构啊，要有一个宣传啊。
没想过，到目前还没想过这个问题。
When you die, would you be happy to donate your organs?
Yes, I do.
感觉好像对自己不吉利，或者说对自己就对这个家庭什么不尊重啊之类的。
You looked quite happy with those responses.
Yeah, I'm very happy.
Yeah. Is that what you expected?
Yeah, really.
Yeah? In what way?
Because that means that we should not blame the culture. We should blame our system.
Which has now improved.
Yeah, now it's improving. Yeah, it's improving. But it's still facing a lot of challenges. I always describe the system as a newborn baby. Need time to grow up. Needed care from the whole society. Also, in my keynote presentation, I say this is the first step of a long march. So I'm facing a lot of challenges. For instance, and legislation, improvement, we need an organ donation and transplantation regulation.
Right.
And also we need a law enforcement because we have big countries with 1.3 billion and populations. It's disparity of the economic, political, and the situations. Also, we need infrastructures and the capacity buildings. We need more and more coordinator, more and more OPO. Also the quotas must be compulsory and to be applied to every hospitals.
Thank you very much for joining us on the program, Dr. Huang.
Thank you, Britt. It's my great pleasure.
If you have any comments or questions, please email us at chinainsight@cctv.com, or you can find us on Facebook, Weibo and WeChat. And we'll see you next time for more stories and discussion on China out of China.